Hello, good evening. Welcome to the ninth edition of Crossroads. And today we are just moving away from our usual track. We have a professional expert in the field of physical therapy, whom I'll be introducing shortly. But we've got lots and lots of questions to cover in the next 40 minutes or so. So I'm not going to spend a lot of time in that. So let me just invite Ms Neha Dhamankar onto the platform here. She is a pediatric physiotherapist who is currently working at Neuropedia, Children's Neuroscience Center, and therefore a colleague of mine. She has nearly 13 years of experience in her field. She's done a graduation from India, then moved to Cardiff University in the UK and did her neuro rehabilitation from there. She worked across neonatal intensive care units and inpatient pediatric care, and then into community pediatrics as well in pediatric settings. She's worked in India and also in the National Health Service in the UK. So she has experienced the two worlds. In Dubai, since she's been here since 2015, having worked in Rashid Center of Special Needs, and then moving to Neuropedia about 2 years and a few months ago. Hopefully, her final destination. Her area of interests are developmental pediatrics and early intervention, and of course, neuropediatric therapy and gait analysis. So, without any further ado, let me introduce and call Neha onto the screen here. We'll let her settle down. Hi, Neha.
Hello, hello. Thank you for that
Oh,
introduction and thank you for having me. Can you hear me?
yes, I can. How are you today? How are you
Good.
today?
Just in and out between patients, just finished seeing a whole bunch of kids, and now I'm
Right.
here and then back to seeing kids.
Right. So, I hope you don't have any kids jumping into your room while this session is going on.
I hope not. I've put my reception team onto it, but then if you do see a kid
Okay.
just run in and out, it is what it is.
Right. So let's start with the first question, which is you telling us about yourself. Why did you choose to become a pediatric physiotherapist? And do you have any regrets now?
Oh, that's the worst question we could have started with talking about myself. Um, to be honest, I didn't choose physiotherapy. I just kind of fell into it, and I'm sure that resonates with a lot of people. It wasn't on my radar. I was good at science, and it just one thing led to the other. But zero regrets. I found my calling. Working with children is just what I do best. And today, at this point, I can't do anything except pediatric physio. So here I am.
So if I am a new graduate and want to take physiotherapy or pediatric physiotherapy as my career, how would you motivate me?
I think it's just, well, pediatrics is a whole different world. Like, you really need to see dealing with children, not just physio, but anything, whether it's
Yeah.
teaching, whether it's anything, whether working with children is something that you enjoy. And I think it's pretty hard for college kids or university kids to figure it out because it's like, their children themselves. And so it's quite hard for young people to resonate with pediatrics. But physical therapy, I think now it's amazing that schools and colleges are actually letting students come into our clinic. Like, I had an intern come in today and just see what is it that we do. Is it interesting? Is this something you want to know more about? Yeah.
Okay. So
So
I
I
mean,
just,
you
I
obviously
mean,
have.
I just do
Sorry.
amazing sessions, and I just hope that they see what a difference we can make in people's lives. I think that is the main goal. I'm not expecting young kids to come into my sessions and they understand, the technical parts of it, but it's just an we have fun, we play games, but then we're still dealing with families and a lot of issues at hand and really making a
Mhm.
difference. So I think that's to
So
summarize.
what are the most common
Yeah.
conditions that you treat as a pediatric physical therapist?
Over here at Neuropedia, currently, I think we're seeing a lot of what we call developmental delays. So, a lot of babies and children who are just not attaining their gross motor milestones. So, you have checklists and apps everywhere now, and parents just come with the concerns that, my child is 11 months old, not crawling, or 16 months, 18 months old, not walking. So developmental delays is the commonest.
Yeah.
Neurological conditions such as cerebral palsy, we have a lot of genetic syndromes coming up now, neuromuscular conditions. Yeah, a lot to do with developmental delays, I think, is topmost.
Right. So conditions like cerebral palsy will be coming your way. Children with Erb's palsy or birth injuries, children having gait problems, coordination issues, also sometimes neuromuscular problems as well.
So a lot of them, yeah, which is general balance issues, coordination issues.
Okay.
Yeah, lots of babies with, if anyone has heard of torticollis, neck
Yeah.
tightness, a tilt to one side. Yeah, anything
So
to
I
do
get
with
asked this question.
movement, like the baby is just not moving the way they're supposed to.
Yeah. So I asked this question very often from parents. Why should I take my child to a pediatric physiotherapist and not an just any other adult physiotherapist? What do you think makes the pediatric physiotherapist ideal or stand out in relation to therapy for children?
I mean, in essence, just in terms of when you think of exercise, an adult physio can pretty much do what a pediatric physio can when you just purely think of exercise. But then with children, it's just the way they grow. At every age and stage, they are constantly growing, and not just physically, but they're growing cognitively, they're growing emotionally.
Yeah.
Everything changes. So we need to modify our goals according to their growth. So that is where specialist knowledge comes in. When you feel like you've figured it out, they have a growth spurt. So their muscles are constantly changing, their joints are constantly changing, their bones are constantly changing. And we need to adapt to this. And that's where you need a pediatric physio. And the other thing is, with us, you're just dealing with the adult. With pediatric physio or any pediatric field, our communication skills, the way we plan our sessions, our goal setting is completely different, because it's not just the child. We have a huge team that is working just in terms of family, the caregivers, people in the community, people in school. And that's a big part of what we do, and we look at their occupation, which is play. So also pediatric physios, although we look only at physical development per se, to engage a child, we need to know everything about child development. So how the child is playing, what is expected of the child, not just in terms of their physical development, but also in terms of play, communication, social skills.
Yeah.
So that is where you need a children's physio, if that makes sense.
Being a part of being a part of Neuropedia, we know that, or I know that you work as an MDT member, a part of the multidisciplinary team that we have. And how do you contribute towards a medical team? And just take an example of something like spastic diplegia or cerebral palsy. So just run us through how you work with the team to give the best
Yeah.
benefit for the child.
Yeah. So if you see a child with CP, say someone with quite a lot of physical limitations, for example, a child who is wheelchair bound, and we know that his ability to stand or walk is going to be very limited, and the child is bound to a wheelchair, for example. We first start with what are the goals, and that's where the MDT comes in. I think, everyone is like the MDTs, physicians and specialists. No, it's the child and the family that have to be in the center of it all, because we can't have an MDT, just talking amongst ourselves without the goal in place. So, for example, if I ask mom, what is your concern? And this is what happens during a physical therapy assessment as well. I was like, don't think of the physical goals because I'm a physio. Tell me what is concerning. What do you want to work on? So if mom's like, I want my child, he's sitting in a wheelchair, a completely assisted device with head support, trunk support, everything, but I'm not able to feed him. So the goal is feeding, right? Because you're like, I can't get my child, he'll keep flinging his head back or his head's down. So that becomes my goal, where I'm like, right, the goal is mom should be able to feed him, and my goal comes into, right, how can I get his head in a good position where, I'm trying to get him to do what he wants to do. And that's where the MDT comes into play. What is the speech therapist going to do? What is the physio going to do? But the goal is common. In this case, feeding. So if I have a child who's throwing back and just not able to feed, I'm going to be on my side. I'm going to work on a chin tuck. I'm going to strengthen this. If you have a child who's just all over the place throwing his arms, I'm like, right, I'm going to work on this. And then the speech therapist is going to work on swallowing, and the OT is going to work on the hand function to get that. So, and if I have a child who's, say, very floppy, and mom's like, I know he doesn't have any swallowing issues because we've had tests done, but I'm not able to get him in the chair. So that's where the planning comes in. What is the goal and what are we trying to achieve? In that case, I'm like, right, let me work on that head control. Let me see if I can get that head up, get the arms down, and then family is happy because they're able to feed their child. So that's how we contribute towards in the therapy team. Obviously, the
Yeah,
medical management is
yeah, yeah.
a whole different.
You know, I've been in this field of pediatrics for 23 years. And what astonishes and surprises me even today is how you pediatric physiotherapists make a child do what you want them to do. And to build that rapport and make the child do those stretches and strength exercises and postural exercises. How do you manage that? Just take us through that.
If it's a baby, the younger they are, it's really important to get the family on board, okay, because we need a lot of support. We are not working alone. If any physio out there feels like I'm going to run the show, I'm going to change the game, I'm going to make this happen all by myself, it's just not going to happen, because you need carryover. So family support is really, really important. And what I find useful is if I explain the why behind something to families, why are we doing this, instead of just giving them a set of things to do, it just works better. So we look at, why is the child, right? Okay, the child's not sitting. Why is the child sitting? We first need to figure out the why, and then go into, okay, what muscle is tight, what muscle is weak, and then just kind of work with compliance. And with older kids, you just, it's through fun and play, right? You make them understand that we're doing this and it's going to be fun, and over time you do build a relationship. But it's just getting everyone on board is really, really important. It's not always pleasant, but we get there.
Yeah.
We get there.
I
Games and a
always
lot
have
of
this.
planning. So I typically say, in a 1 hour session, we possibly do about 20 minutes goofing around and chatting and all of that, and it's only 35-40 minutes of actual therapy, but that is what is effective.
I always have this discussion with parents, because a lot of parents who have children with severe disability or severe cerebral palsy, and we know these kids might not be able to walk independently in the future. But the goal is always, I want my child to walk rather than discussing mobility, because you can be mobile without having to walk even. So, how do we instill this concept into parents that walking is not everything? Yes, that's our goal in many cases, but in your child, that's unlikely. And we'll work towards a different form of mobility and focus on other areas of development. How do you go about convincing parents in this area?
I think it depends on the diagnosis. For example, with cerebral palsy, we have our gross motor function classification scale. It's quite clear, and I actually go through it with parents, like evidence based. We have levels of CP 1 to 5, and it's never an easy conversation. I mean, let's just start with that. You do it year after year, and with hundreds of kids, it's never easy. It's heartbreaking, but we go through it. So it's a bit more objective when it comes to a diagnosis like cerebral palsy, for example, where we say, look, your child is on a level 4, and we have evidence saying that he's going to remain at 4 or at the most get to 3. And honestly, the way I explain it is, if it's difficult to the point where it's frustrating a child, then we got to start thinking of what do we want out of him or her, and not setting the child up to failure. Because if we set
Yeah,
expectations
that's very
where, and
important.
it typically happens with a lot of the younger kids, because when they are young, They're very flexible, they're moving around, and there's a lot of things going on. But it's just trying to understand what happens with growth. And that's exactly where, going back to the previous question, pediatric physio, what happens to a growing child. And then if a muscle is tight or it's spastic, where the tone is high, we know what happens. We're able to predict what is going to happen to the growing child to an extent. And I think it's just over time. Again, that goes to goal setting. If a parent at 2 just goes like, I want my child to walk, I'm like, whoa, wait, let's go to short-term goals. What do you want him or her to do in the next 2 months? And let's start working on that. So is it walking because you want him to get from point A to point B? Is there any other way we could work on it, but he's still doing it on his own? And it's just breaking it down. But I think walking is, yeah, it's like the ultimate goal for parents. It's never easy, but I think they do get it over time. It's never easy, but
You
yeah. And I think over time they do stick with the therapy program. They understand that we're on the same team.
okay? Sometimes it's very difficult when we have parents, and because you provide physiotherapy for maybe an hour, 2, 3, maybe 4 hours a week, but most of the work usually is been carried out at home by parents because it has to spill over at home as well. How do you keep parents motivated and train them to provide the child appropriate levels of parental involvement? I'm sure more than me, you in your practice would face this, where you have to train parents to carry out a certain program for the child, so that what you do in your clinic can be beneficial as well.
Yeah. I think with young babies, it's first of all understanding dynamics. It's very easy as therapists to go like, right, we know that you need carryover at home and you need to do these exercises every day, 6 days a week for your child to improve. Like, that's a horrible thing to say to families, because then if they miss a day or two, that's it. There's so much guilt, like, I'm not doing enough for my child. And that's just not the way to approach it. So we start with, again, the why, explaining to parents during sessions. And that's why I want parents in sessions, I want caregivers in sessions. And while you're doing it, once we explain to parents why we are doing something, it just registers better, because then they understand the practical implications. So even with severe physical limitations, wheelchair bound, we're making him stand, and you might be a parent going like, yeah, but he's not going to walk, why are we making him stand? And you explain to them, you show them, look, I'm doing a transfer here from his wheelchair to the chair, and it's taking less effort because he can help me, and he's going to grow, and he's going to get bigger, and this helps you. So that's just an example, but when you break it down like that, they understand the practical implications of it. And the other thing is to keep it short, not give a long list of, 10 exercises, because any child we see, I can literally 580 exercises I can do with a child, but that's not the point. So I would typically do a session and then see what is the most effective thing. And I'll give parents maybe one thing to do at home. And I go like, listen, can you just do this one thing? Because I know, and that comes from experience and working with a child, that at this point, if there's one thing that the child needs to work on, it's this. Whether it's standing, say just coming into crawl, I mean, whatever it is. Can you just do this one thing? And if you wake up and you're feeling amazing, here's the second one. And just do that and follow up. So it's just breaking down the tasks and explaining to them the why. If we go on a level where we are like, we are the experts, you do what we say, and you're going to see results, it's just never going to work. And it's with you and I, right? If I tell you that you need to go and do 20 push-ups and you have no idea why would you do it? But when you break it down, and there's a lot of talking, there's a lot of conversation, but it needs to happen. It's not a waste of time, because when you tell them why and what you're trying to achieve, that's when you get compliance. And it's again depending on the home situation. If it's a baby and it's the first child and mom's at home with the baby, I might add more to it because I know she has time. If she has a baby and she has another toddler at home, then everything changes. And I don't want to stress her out going like, right, that's your problem, but you still need to work with this child. No, I'll go like, right, when your toddler is in nursery, can we do this and this with the baby? So, it's just breaking it down, keeping it easy. I never give more than two things to do with children at
Right.
home.
Yeah, that's very helpful.
Yeah,
Um,
if that helps.
Sometimes you, as a therapist, and of course parents, can get really frustrated because you don't achieve the results that you were expecting, in spite of the parents being very compliant, you being very putting all your effort, still you're not getting the results, and that happens. How do you deal with that situation, and how do you keep that trust among parents that, just hold on and we can achieve that later, or give it some more time?
Yeah. I think, I mean, me getting frustrated is just, that's gone. I think that happens possibly when you just start off because you've learned all these skills, like you've gained all this knowledge, you've gained these skills. We do a lot of hands-on techniques, and you want to apply them to the kids and see if it works, right? So a lot of it new clinicians where they're like, right, I've got this and this and this, and I'm planning, and I can't wait to apply all of this learned stuff. That's when frustration comes in, where you're like, right, I'm going to get the results that I want. And if the child is just not having it, or the family is not having it, you get frustrated because you're like, I had this plan in mind. Again, going back to, it's not about us, it's about the child, and it's about the family. So
Yeah.
that's where that answers the frustration part on my end, where I'm constantly problem solving. Right, I have done this is not working, what else can I do? Because every child is different. So you might go with a plan, but you need to have a plan B and a plan C and a plan D, just depending on, and like I said, growth, right? You just feel like that's it, the child is doing so well, someone with high tone cerebral palsy, and you're like, that's it, they can stand and they're walking, and then they have a growth spurt and boom, you go down again. So what are you going to do now? So that's the frustration on our end. Parents, again, it's explaining to them time and time again what effects growth has on a child, what affects your cognitive development, your mental development, your emotional development. All of this has an effect on a child's physical development, and it's just understanding and seeing the child as a whole. And that's why being a physical therapist, it's not enough where I just do the physical bit and go like, someone else will deal with the rest of it. It just doesn't work that way. We need to look at everything. There are times when I tell parents, I'm a physical therapist, this is my job to make kids strong, but I feel at this point the child's focus is somewhere else. They are too much into their speech, their cognition, doing other things. So let's support the child physically, but just go according to what the child needs. And there are frustrating moments, but you just navigate it one step at a time.
Okay, moving on to advancements. Now, at least in my field, pediatric neurology, and it's a part of neuroscience, in the last 15 years, things like genetics, new MRIs, technology has completely changed the way we practice, and we are getting more refined, more sharper. And I'm sure in the field of physiotherapy, this the same. In the last 15 years, there have been the changes that have come through. How you have incorporated this in your day-to-day practice, and what are the advancements?
I think one of it is, we spoke about this, the MDT, bringing teams together. It just wasn't the case 15 to 20. Everyone was doing their own thing. Physios are doing the physical part, speechies are doing the speech part, OTs are doing the OT part, and even families were centered that way. They'd go to a physio and they'd be like, this is the physical problem, let's just do this. Speech, let's just do this. We are truly starting to see the child as a whole. And we are doing this during our sessions as well. So I don't go in saying, right, what are your physical concerns? Yes, that is the area that I am the expert at and that I'm going to tackle. But I want to know about everything else, because I want to see whether there are other factors into play. So that's one of it. So the MDT game is really changing, which is good because we're able to provide a lot more for the child. So that's one. I think the other thing, the therapy team is reaching out to communities a lot more. So we're going into schools now, we're doing a lot of home therapy, school therapy, going out into the community, getting schools involved, getting a lot of caregivers involved, nursery staff, anyone out there. So these are like the two big areas that have really, really worked for us.
What about technology wise? I mean, in terms of new modalities of therapies, is there anything that you think has changed in the last 15 years?
I mean, there are some, there's like CME, there's DMI, there are, the hyperwide machines come and go. It's about the goal. They're also very
Okay.
expensive. So it just depends on the place of practice, your area of practice. and
Yeah.
all of it. I would never choose a modality or a piece of equipment where I go like, if you don't have this, then your child is losing
Yeah.
out. It's why I don't talk about it much, because we've got to work with what we have. Robotics is such a big field in rehab, but it's not like everyone has access to, robotic devices for walking and stepping and all of it. So yeah, there is a lot out there. I mean, just standing frames, for kids who are not able to stand, there's so much equipment, wheelchairs, like there's some amazing stuff out there with powered wheelchairs, manual wheelchairs, sports wheelchair. You can do anything and everything. So yeah, there's a lot out there. But in terms of therapy, our hands-on therapy, I think we've just become more goal-oriented, keeping the
Yeah.
child and function in place. Yeah. But I
Yeah.
don't
Neha,
I
I'll
don't give
move
that much
on.
importance to it.
Yeah. So we always emphasize to parents that early intervention has the best kind of chance for your child. It gives the best chance for your child, and we have to look out for red flag signs early on with regards to physical development. What's your take on this? I mean, in regards to physiotherapy, if you start early, you can have a better outcome. Is that a right statement?
Like 500%.
Mm.
Early intervention is key. Like, I can't even stress more than that. We have the evidence for it, we've seen it. What we get from 0 to 3 is unlike anything. And, it's a difficult time because a lot of parents take time to come around what is happening with their children upset. They're new to the whole thing. It's hard, but it's extremely fruitful because we know that the synapses, the neural connections, everything that happens in the brain is maximum in that. So even in physical therapy, we are starting to look into what we're calling the fourth trimester wellness. What happens from 0 to 3 months, what to look out for in babies. For example, flatheads. Flatheads are affecting like half the babies today. 50% babies have flatheads at some point or the other, which is noticed at 2 or 3 months. It's so easily avoidable, but it needs to be picked up. Asymmetries, tightness, torticollis, those kinds of something that we are starting to look into. So yeah, early intervention is key. Give everything you've got to your child, therapy wise, in the first 4 years of life, and it's going to work out well. And also, 0 to 3 is when the child is at home, right? And I tell this to family that once they go out, they're going to grow up, they're going to go to nursery, they're going to go to school, they're going to have a life, they're going to have friends, go to college. So let's use this time because you're at home with the child or whoever is at home, and make maximum use of this, because later on a lot of factors come into play.
My wife is an obstetrician, and if I tell her fourth trimester, she will kick me out of the house, I guess. Um, it's a new concept that
That's what
I
it's
have
called. Have you not heard of
I
it?
know, I know. It's a new concept for me. I'm sure it's right, and people are accepting as a forced trimester. But I need to speak to her. Maybe that's all I have to say. Moving on, we got little time left. Whenever I pass by your room, I can hear, not your room specifically, any physiotherapist. At times, we hear children upset and crying during their therapy. Not your room, Neha. I can assure you. Don't make those faces. It does happen when they are, first time or in the first or second session, where kids obviously don't enjoy the session as much as they would later on. So, how do you deal with the situation, and how do you convince parents that things are going to change?
It just it's a lot with the younger kids. First of all, again, 0 to 2, 0 to 3 is when we get our babies just not having it. Going back to, we know what early intervention can do to a child, right? We also know from evidence that when a child is happy, when a child is engaged, when a child shows intent, is when you get maximum learning. So we know that. So we don't want a stressed child. Having said that, parents do get upset. First of all, I tell parents to just, chill out, because I can't explain it to you, but they can read. So if a child's being fussy and, mom's like, oh my God, like, can I just get him? They read it. I don't know what it is, but they just cry. So I'm like, just relax. Then it's looking into physiological factors, the obvious ones. Is the baby hungry, tired? Is it just not a good time in the day? I can't be adamant about, I'm going to do the session on Thursday at 12 o'clock because the only time I've got. If it's the baby's nap time, they're going to be really upset. So it's changing all of those factors. First of all, the obvious ones, getting to know what they like, what they don't like. Again, I'm not someone who would go into a session and be like, right, I'm going to do all the therapy and you're going to sit to the side because I'm the expert. No, moms know how to deal with their children. So I get parents involved a lot. If a child is really upset, I would, especially with babies, really small babies, I'll have like a doll and I'll be like, can I just show you what I want to do? And then maybe you can try it out. It's it's passing, it's just passing the option to parents, right, your child is getting really upset. What do you want to do? Do you want me to continue? Do you just want to take a break? Sometimes I'll take the child, we'll do a little bit just so they understand what the hands on is. And I was like, now you can try it with the child. What else can I do differently? I think
Yeah.
the key point is not just going in there and saying, right, some babies cry, so just deal with it. That's wrong. It's just trying to understand, what can I do to make them happier, and how do you want to play this?
Neha, what is the importance of home program for families and caregivers? How important is it?
It's it's key. It is important. um, Again, your home program doesn't have to be extensive. It's not something that should stress families out, because when you're living with a child with any kind of disability, life is hard as is, and we're not trying to add to it. It's again going on to why. And home programs are important, and I always, especially more the physical limitations, I like to just draw it into active exercise part and the passive exercise part. So we have lists saying, when you want to work with your child, again going back to, can you do this one or two things? Every time he goes to the toilet, can we make the child stand to wash his hands? So that's
Hmm.
one. And two, can you make him do maybe 5 squats a day to pick up something when you're playing, for example? And then you have the passive part where, okay, you have work to do around the house. Can we put him in a standing frame, or can we, put him on the floor in a stretch position, and then you go about your day? So are really important, but it's important to see what the child's life is like. What are they doing in their day? If a child is going to school from 8 to 4:30 and you're giving them this whole bunch of things to do, it's just, it's not practical. So it's important, but it's also important to look at what we're telling families to do, and how every family is different. Some of them are like, that's it, like, I want to do more, tell me more, what more I can do. And that's fine. But that doesn't mean that the family who doesn't have time is made to feel guilty that, oh, I'm not doing the best for my child. So it's just really working with schools. A lot of kids do a lot of things in school, during PE, during classroom sessions. It's really going into schools, working with their shadow teachers, what can be done. So it's really, really important, but
Yeah.
it needs to be graded. It needs to be explained.
Neha, we've
Yeah.
got 5 minutes, and I've got two questions. The first one is, how do you decide on frequency of treatment? How do you know that this child needs 3 times a week of physio and this child needs once a week?
I mean, in Dubai, in Neuropedia, it's a lot based on your insurance model as well. And what's happening. Sometimes we want to see the child more, especially younger kids, and then you're not given the option. It's again going on goals, and I try to see how much is the family able to work with the child and the response. So again, going back to, if I have a child who's getting very, very upset, and mom is like, actually, he's doing a lot better at home, then my frequency is going to go down. Overall, again, early intervention 0 to 5, I want to give more, but it's taking into account the other things. So sometimes a child would only need physical therapy, no other
Yeah.
therapies, in which case I'd say, okay, we can really, really work on this aggressively, and let's see him 2 or 3 times in a week. If a child has global developmental delay where he needs a lot of support from speech therapists, from from OTs, from physios. I'm not going to say come to me 3 times a week because I know that there's a lot going on in this child's life. So it's again, I think that's the key thing. There is no formula. It's about seeing how to go back and forth with this. But the point is that we need to be able to empower parents to kind of carry out a lot of stuff at home without stressing out. The key is never to let families go like, you can't do without a physio. And this is really, really important as kids grow up as well. They become so dependent on therapists because they've been doing it all their lives, right? And I'm like, you can do this. You can do this. Like, I have moms with babies who are like, I tried this and this with them, but I just can't do it the way you do it. And I'm like, yeah, but I've come to see you after a week and they're doing much better. So obviously you've done something right. So, it's just going back and forth with what parents are comfortable with and what you're comfortable with.
Yeah. So if I'm a first, I mean, I'm a parent, I'm bringing my child for the first time to you, and you say, okay, your child needs a physical therapy assessment to decide the frequency and the goals and the strategy. What does that assessment mean for me as a parent? What should I expect?
Right. So here, most of the times, parents, a lot of families come in because they've been referred. They don't even know why. I mean, they know the basics, like, it's something to do with physical, but, especially like premature babies who are told, like, yes, they are going to develop weight, but they're going to get there. So why be in physical therapy? So it starts with telling them what I should be looking at, what things you should be looking at. And there are two parts to it. Either the parents come with concerns, in which case we start going down that route of what their concerns are. I mean, you might find it hilarious, but they're like, we have no concerns. And I'm like, then why are you here? So, like, can you tell us, physically what I should be looking out for? Then I go down the route of, right, this. Let's look at how he's playing, how he's moving, how a baby is functioning, and if I pick up anything, I'll just explain it to them, going, okay, these are the things that we could work on. If they're concerned, I would typically start with, maybe doing a little bit more just so that parents feel confident, and then reduce reduce the intensity as they feel confident. But at the start, I would possibly go a little heavy just to reassure them.
Yeah. Neha, thank you so much. That was a fantastic session, a very useful one for, I'm sure, all the viewers, parents, and even therapists, other therapists who are listening to us, I guess. I learned a lot from this. And if do you have anything to say to the viewers here? Any message you want to give out? Anything that has been bugging you for a long time, and you thought, okay, let me just broadcast this to people out there. Go on. It's your platform now.
I think it's just, the therapy field is very much into something has to be very major to reach a therapist. And again, going back to the fourth trimester thing, don't laugh. We are, for example, we are trying to look at, because it's a hard thing, you have no idea. And for the first 4 months, you're just trying to keep the baby alive. Like, is my baby sleeping? Is he eating? So there's a lot that we can pick up very, very early. And we're trying to go down the path that if there are concerns, like if you see anything, just reach out. Like, even as physical therapists, if a baby comes saying, I feel like my baby's not moving, or I just feel like they're not reaching their milestones, I'm going to be looking at, are they in the right direction? If they are, I'm going to be like, listen, baby's fine, go on your way, don't want to see you again. But if I pick up something, then we can start early, so it's just not being afraid to kind of reach out. And the wait and watch approach is not, it's getting a lot
Yeah.
of families into
So if
trouble.
I were to summarize this, it's basically identify early, intervene early to produce the best results in kids.
Yeah,
Yeah.
yeah.
Okay.
And we're a
Thank you
fun
so much,
bunch.
Neha. Yeah. Yeah. But thank you. Thank you so much for your time. I think you can get on with your patients now. And I'm sure this will be very beneficial. We're going to upload this very soon on the system and trying to reach out as many viewers as possible. So hopefully, next session, we can talk about something else. But thank you. Thank you again.
Yeah, let's do it. Amazing. Thanks.
Thank you. Bye bye.